crazy few weeks for all of us. And we still have a lot of questions, which is why we have invited Dr. Juan Dumois. He is a pediatric infectious disease physician at Johns Hopkins All Children's Hospital. Dr. Dumois, you have been a wonderful resource for us and for our readers just throughout the past few weeks of COVID-19. And, we heard our president yesterday predict dark days ahead of us for the next 2 weeks. What is the latest of what we're seeing, especially here in the Tampa Bay community?
What we're seeing now in the Tampa Bay area is a gradual increase in the number of cases that are sick enough to present to the hospital. Our numbers are going up and probably will continue to go up in the near future.
And what have we noticed that if the symptoms are any different in kids, or is this impacting children any differently than where we were a few weeks ago? Because we do have reports of local kids having confirmed cases, and even a report in another part of a country of a baby dying. Are we more concerned now about how this is impacting children?
We have, as you said, we have gotten more information about how kids are affected. The symptoms in children are very similar to those in adults. There are no really dramatic differences in the symptoms that we would look for in children, other than we know that the younger a child is, and with more limited ability to communicate, they're less able to express that they have a sore throat, for example. So something pediatricians and parents have always had to do is rely on the symptoms that they can observe in their children or in their patients. That is still about the same. We know that there are occasional cases now where children have died, not only young children under a year of age, but even older children up into the teenage years. But those are relatively rare. And we don't always get good information on those reported cases from distant sites about what sorts of underlying medical conditions those children have had. I did hear that the recent case of about a 1-year-old child who had died did have some kind of underlying medical condition, but we don't know what.
We do find that our child is presenting with symptoms. Should we take them in to get tested for this and screened for COVID-19?
That is one of the big questions right now. And the answer to that question seems to change every few days or at least every week, because the answer depends upon the availability of a test. So I think that one of the first calls you might want to make if your child is sick and you're curious about what to do and whether they had COVID-19 is to call your child's doctor. Whichever doctor you have the most communication with, whether it's a general pediatrician, or if your child has underlying medical problems, say asthma, to call that child's asthma specialist if they have one. That doctor may then be able to advise what they have been doing for their patients. So, for example, there may be some doctors who have been trying to collect specimens for testing, and they may do it in a special way, like you come to the office, but you stay in your car and they come out to your car to check on your child, to do the examination, so that your sick child is not coming into the office to expose well children. They might also try to have the specimen collected while the child is still in the car. Some clinics are not offering that yet, and testing is then referred to other places. You can't go to a commercial lab like Quest or LabCorp to have your child's specimen collected. They're not doing it. They are receiving specimens that have already been collected somewhere else, like some of these specimen drive-through collection sites where they do it for as long as they have the equipment to collect those specimens. Most emergency centers and a lot of urgent care centers do have the capability of collecting a specimen and sending it off somewhere else. But don't just go somewhere without having called expecting that testing can be performed, because you may be turned away and saying, no, we cannot offer that. Your child is not sick enough, or we don't have the supplies.
And at this point, we've been practicing social distancing, or we should have been practicing social distancing for a couple of weeks now. hopefully that means that we're reducing the number of any potential new infections. But when a parent goes out, I know that's been recommended to designate one person in the household to do the grocery shopping, to go to work if they have to. What steps should we take when we are out and about in those public places? Should we be removing our shoes when we get home and our clothing? We know to wash our hands, obviously, but what should we be doing for what we know up to this point?
Yeah, because once you leave the house, it gets kind of complicated. And people are wondering about wearing masks and wearing gloves. And I've seen people out in the stores wearing gloves or masks and not necessarily doing it correctly. Uh, I think gloves are relatively useless when you're out in public because people don't always have an understanding of how to use the gloves properly to protect yourself and to protect other people. So if you're wearing gloves and you're using those gloved hands to touch everything and to touch your face, it's like not wearing gloves at all. You're just not using them correctly. It's better to not worry about the gloves because that might give you a false sense of security to wear the gloves. But when you're out in public, focus on not touching your face because we'll assume that you're touching things otherwise out in public. You're touching things in a store or you're touching other objects that may have been touched by sick people. As long as you do not touch your face before cleaning your hands, you probably won't catch anything in that manner. But then the other concern is, what about somebody who's sick and coughing into the air? There is potential transmission of of the COVID-19 virus in the air, especially if someone coughs near you. Depends on whether you're indoors or outdoors. And if the indoor environment has good airflow and it's like a comfortable environment, or it's a stuffy room where there's not a lot of airflow. In the stuffy room where there's not a lot of airflow, you're going to have virus that could potentially be suspended in the air for hours, causing other people who come into that room. But outdoors, where anything that I cough or sneeze into the air is going to get dissipated very quickly just through natural air currents, and any virus that gets suspended into the air outdoors will also be inactivated in some time by ultraviolet light from the sun. We know that ultraviolet light does kill COVID-19 virus. So how careful you have to be when you come back home depends upon what sort of exposures you had out in public. If you went out for a walk or to take a pet for a walk, that's a relatively low risk of exposure, even if you passed people along the way. If you happen to be passing someone who coughs right as you're passing them, you can hold your breath for a few seconds until you get past that area of coughed air. But the clothing is going to be less likely a source of transmission, but it is a possible one. People do sometimes want to feel more careful by removing the clothing when they've been outdoors as soon as they get home. And I think that's fine. We know that the virus can exist on fabrics for a short period of time, maybe a matter of a couple of hours. It does not seem to last as long on cotton as on artificial fabrics like polyester. So people may keep that in mind when going out, what kind of fabrics to wear.
That's very interesting. And, we were talking about outside too. Is it okay for maybe a child to play outside with a neighborhood child because they are outside in the UV light? That is a question that we've seen raised.
Whether your child should play with other children depends a lot on the age of the child. Children who are old enough to maintain social distancing, those are going to be like preteens and teens. Maybe they could do something outside in the vicinity of a friend, but they still have to maintain that social distancing. And if there are any common objects that they're going to touch, you have to have hand sanitizer available so that they can clean their hands right after they've touched that common object. Younger children, forget it.
Yeah.
You cannot get them to not touch each other, to do the social distancing. You lose attention of what your children are doing for a second, and they're like 10 yards away, and you don't know how they even got there. So no, with younger children, it's probably best that it's you and your child doing stuff outside alone.
And I know one big concern is the people who are sick that are asymptomatic and that could be spreading this. As a physician, how what do you think about this? What's your advice for parents on how we handle this? Because we're probably looking at more than just the next month, right? Of being practicing this social distancing
Right.
for that
The
reason.
thought, the thought of asymptomatic people spreading it is a definite concern, and we do think that that can happen. In general, though, when people are not symptomatic but do have virus in their saliva or mucus from their nose, they're not sneezing or coughing, so it's not as easy for them to spread it. Also, usually they don't have as much virus in their saliva as the person who is actively sick with symptoms. So it is not quite as easy to spread. So spread is usually going to occur not just by them exhaling virus into the air, but more commonly by touching their mouth and then touching the objects that other people are going to touch. Because if you think about if you worry about people who are asymptomatic spreading it, you're really going to consider anyone out in public as being a potential source, and you'll go crazy thinking about it. There are relative stages of contagiousness, and you still have to go out and get your groceries or find ways to get your food delivered, and there's no getting around that. You just have to realize that some people are going to be more contagious than others, and that's why you want to maintain the social distancing as much as possible when out in public, and the frequent disinfection of your hands before you touch your face.
And wiping down the groceries. I know I've read about soaking vegetables and fruit in some sort of like a diluted bleach solution. Is this a good idea? Because we don't know who's touching some of these things before we purchase them.
Well, diluted bleach is an excellent disinfectant. It'll kill everything, most viruses and bacteria. Um, if one feels more comfortable doing that, then it's a safe thing to do. The bleach can be very dilute. It does not have to have a lot of bleach in there. And the same bleach can be used to wipe down surfaces in your home that have been touched by people coming in from outside. And they can also be used to wipe down the outside of objects, say packages that are delivered into the home.
Probably one of the most cost-effective, I think, ways to disinfect at this
Yeah,
point.
yes,
You know,
bleach is going to be very cost effective, relatively low cost.
and let's talk about those readers of ours who are pregnant or want to become pregnant. Is what extra steps and precautions should those women be taking right now?
Well, when women become pregnant, their immune systems become a little bit weaker in order to not reject the baby as a foreign body. Um, Therefore, when women get sick during pregnancy, they often are sicker. And with a variety of viruses, including influenza, we know that the chance of ending up in the hospital or even dying of the flu is higher when you're pregnant. We're not seeing a lot of that being reported right now with COVID-19, but there's still that concern. And I think that any woman who's pregnant should be vigilant at all times about trying not to be around sick people, including sick children of their siblings, cousins, or friends. And they should also be experts at hand hygiene, cleaning their hands before touching their faces. But that's not just now, that's always.
All the time. Yeah. And newborn babies, I guess the same applies. You typically keep a newborn baby within your close circle of family anyway, especially at first. But
Yes, and especially in the first month of life. Because whenever a newborn baby gets a fever in the first 4 weeks of life, the standard of care in the United States is that for any baby in that age range with a fever, is that they have to be evaluated with blood testing, their urine will get checked, they may get an x-ray, and they'll usually need a spinal tap. And
yeah.
they'll be hospitalized for a couple of days of antibiotics while awaiting culture results. That's for any fever in the first month of life. So what I usually recommend to new parents is that that baby does not leave the home for 4 weeks, that you screen any visitors to the home because everyone wants to come see the new baby. And those visitors have to be screened for any recent symptoms of illness. If they just got over a viral illness and are asymptomatic now, they're probably still shedding virus. They touch the baby. Or even the well people coming to visit need to clean their hands for at least 20 seconds with soap and water before touching the baby.
And what makes this virus maybe so different than, let's say, the flu? I know we know the infection rate is higher, but let's talk about more about what is a virus, how does it work, and why certain things like bleach can essentially kill a virus. Like, is it alive?
Yeah. So viruses are microscopic organisms like bacteria, but they're even smaller bacteria. They're smaller than bacteria. They're so small that viruses can infect bacteria and destroy those bacteria. So those same similar viruses can infect the cells in our body. It's not something that we can see, but as those cells are being destroyed and as our immune system recognizes, hey, there's a virus here, let's fight it off, the immune system fighting it off is what tends to give us our symptoms. Different viruses affect us in different ways depending upon their ability to infect different cells in the body. So some viruses will focus in on the cells lining the intestinal tract and give you vomiting, diarrhea, and belly pain, whereas other viruses work more in the nose and throat and give you symptoms related to those areas. What's different about COVID-19 compared to the flu is that it is at least as contagious as the flu, or maybe more contagious, but it also seems to be more dangerous. Now, we don't know exactly why that is. Part of that may be that this is a brand new virus and nobody has immunity to it until they've caught it. And when you don't have any previous immunity, either as a result of previously catching the virus or having had a vaccine which doesn't yet exist, then you're likely to be sicker than with a virus that you may have been exposed to or immunized against in the past. Influenza vaccine has been available for decades. A lot of people are immunized. The people who are not immunized against the flu are the ones who tend to get sicker and are more likely to end up in the hospital. So those are some of the reasons why we're seeing so much more disease, a lot more business in the hospitals as a result of COVID-19.
And as a physician, I mean, I'm sure this is something that we know could have happened one day potentially, but this did happen so fast. I mean, how are you feeling about all of this right now? How are you doing?
Physicians and other healthcare workers who are on the front lines have a lot of concerns. We're foremost concerned about our patients. And we always want to provide the best possible care, but we also want to do it without harming ourselves. So the concerns are when patients come in with COVID-19 and they're sick enough to be hospitalized, they need oxygen, we wonder, well, are there any medicines that we can give that may help get rid of the COVID-19 virus faster? We're still trying to learn about which medicines might be helpful in that respect. How do we keep from accidentally spreading their COVID-19 virus to ourselves who are caring for them, or even accidentally spreading them to other patients in the hospital who don't have COVID-19? Because hospitals still have patients who have to be there who do not have COVID-19. So that's where the use of personal protective equipment, PPEs, that you hear about in the media comes in. And we want to be able to wear masks and use disposable gowns and gloves properly so that we don't get sick and we don't accidentally spread it to other patients in the hospital setting or even in the clinic or emergency room settings. And when you hear about shortages in the supplies of those masks, that's causing a lot of anxiety among healthcare workers. Healthcare workers are getting sick with COVID-19 and are having to stay home. And when they stay home, having acquired this virus often at work, they're trying not to spread it to their family members, because then you feel very guilty for spreading your virus to someone else at home. So there's a lot of concern and anxiety, but healthcare workers remain dedicated to caring for their patients.
And as far as like, do you guys have enough masks right now? I mean, did the hospital get a recent delivery? Are you guys ready and prepared for any potential surge that we could see locally?
For now, I think that our hospital is ready, but we and other hospitals across the country continue to look at ways to conserve our limited supplies of masks and others and gloves, for example. Some of the things that we're looking at are, instead of just disposing of a mask right after it's used with one particular patient, in some cases we'll wear a mask for a longer period of time before disposing of it. We're also looking at the possibility of sterilizing a used mask that may have viruses or bacteria on it so that it can be reused. And there is some scientific literature to suggest that that is a viable thing to do, such as with ultraviolet light or heating the masks in an oven may completely sterilize the mask without affecting the filtering ability of the mask.
And showing back up in here too. Sorry, my kids are downstairs trying to get into the office. I've locked myself away in our office outside. It's been, I know it's a challenge for a lot of parents, a challenge for you as well. What can we do as a community to support you all and local hospitals in the area? Is there anything that we can do?
Some people who had previously stocked up on to hoard some of these personal protective supplies, especially masks, have started donating them to local hospitals or clinics, and that's always very helpful. I know that some doctors in private practice who are continuing to see sick patients have very limited supply. And by limited, I mean they may have 5 masks left in their whole office. Donations of that nature, even to your own child's pediatrician, would be very helpful. Some people are starting to make masks out of cloth using different templates that are available on the internet, and those can be useful to cover the disposable mask and make it easier to use those masks for the disposable mask for a longer period of time. The cloth masks, of course, can be laundered in between uses. More and more hospitals and some clinics are starting to use those, and I think that if people feel inclined to help produce those and donate them, that also would be a good thing to do. I think that trying to remain somewhat educated on what the newest recommendations are for testing in your area may be helpful. If you can find that information online with the local county health department, that is probably a good idea so that you can see what sort of testing is available in your area. But don't just show up at a clinic or a hospital expecting that testing will be performed without calling ahead, just to be sure.
You were talking about some of those fabric masks. I've seen those for sale as well for the general public to buy. Just the fabric ones that people have made. Should we be wearing those when we're out and about? Maybe even if it's a way to not to touch our face, or have our children wear it if we're concerned and out and about?
Yeah, good question, because I had an opportunity to look into different types of masks and their efficiency. A regular cloth mask without any extra filtering paper within it has very poor ability to filter any germs from the air, maybe 5 or 10% at best. So wearing a mask in public, a cloth mask in public, isn't really going to help you much. It's not going to protect you from someone who just coughed near you, if that's the reason you're wearing it. Cloth masks, however, may be helpful if you're sick. If you have to venture outside and you've got a scratchy throat, and you might even cough when you're out there, the cloth mask can catch a lot of the particles that you would have expelled with a cough and protect other people. That's a very good, helpful use of a mask out in public, is if you have some symptoms. Ideally, you wouldn't be out in public at all if you had any symptoms. Sometimes that's not avoidable. Some people have looked at making masks out of coffee filters. I don't know if you've heard about that, but I've seen that online. So I looked into the size of the pores in coffee filters, and they are not small enough to filter out the organisms you'd be concerned about. So again, the mask will not protect you from inhaling organisms that somebody may have just coughed up. Well, let's go back to the issue of cleaning your hands before you touch your face.
Yeah.
We all have face touching habits.
Mm-hmm.
And if we can remain conscious of those habits and not touch our face until we've had a chance to clean our hands, then that's good enough. But if we cannot stop ourselves from touching our face, and we only realize that we're doing it after we're already doing it, then a mask may serve as a reminder to not do so because you just haven't been able to stop touching your face any other way. Then that mask reminds you, oh, I need to clean my hands before I finish doing whatever I was going to do on my face.
That's a really, yes, good point. And, you know, we were also talking, and one thing that you had mentioned before in our last Q&A was when it comes to that hand sanitizer, obviously washing the hands for 20 seconds, but there's a right way and a wrong way to use hand sanitizer in a lot of these sanitizing products.
Yeah.
Right?
It's easier for people to follow the directions for using soap and water for 20 seconds than to use hand sanitizer correctly. But if hand sanitizer is used correctly, it's usually as good as soap and water. The mistake most people make about using hand sanitizer is they don't use enough. So the proper use of hand sanitizer is that you have to put enough of the liquid or gel in your hand so that as you're rubbing both sides of both hands, and don't forget the back of your thumbs, that's often forgotten.
Yep.
It takes at least 15 seconds for the liquid to dry. Most people only use enough to where it dries off in 5 to 10 seconds.
Mm-hmm.
That was not enough. It has to be 15. If it dries off in 5 to 10 seconds, you need to do it again. So start off with maybe 2 pumps of hand sanitizer and count to 15, and chances are that'll have been enough if it stays wet for at least 15 seconds.
And when cleaning at home, cleaning those doorknobs, making sure that the product stays on long enough too. In this case.
Right. So when you want to clean with a damp cloth or a damp wipe, that as you've wiped the object, it stays wet.
Mm-hmm.
You stop wiping. The extra time that the moist disinfectant is sitting on the surface, that's more killing of any viruses or bacteria that were on that surface.
Well, thank you so much for joining us today. I know we've taken up, you're very busy, taken up a lot of your time. Is there anything else that you want to add that we didn't quite go over that you really want our readers to know about and just to keep in mind as we go through these next couple of weeks, potentially a couple of months?
I think that you covered some really good questions. And we covered some really good questions in the last few minutes. I think it's important to realize that this is temporary, although it may last for several months. The social distancing, at least in the Tampa Bay area, seems to be working, which means things are going to last longer, but won't be as bad overall, especially in the hospital setting, than if we didn't have it under control. And we're seeing some of that problem in New York City, where things have gotten out of control. We want to keep things under control so that if you do end up at the hospital and you have to be admitted to the hospital, you can get the proper care to save your life. So that's why we're continuing to see these recommendations for social distancing. It is important for now, and we'll see in the upcoming weeks how successful we've been.
Very good. Well, thank you so much. We will let you get back to it. We do appreciate your time, and everybody stay healthy. Dr. Dumois, you stay healthy too. We need you,
Laura.
all of your, and give everybody, I guess not a big hug, a big virtual hug, because you know
Okay.
how hard you're working. Exactly. Well, thank you so much. And everybody, as I said, stay healthy and have a great day. Bye.
Bye-bye.